Hello everyone. Today we're going to go over Unit 3 of the RIA MAP training guide. We're going to be talking about medications, the purpose of medications, medication categories, medication outcomes, and medication information resources. So a medication are a substance that when put into the body, it's going to change one or more ways that the body works. Medications are used to treat different illnesses, diseases, pain, or behavior. The goal of prescribed medication is to decrease the person's symptoms or improve their quality of life. You're going to learn how to administer medication safely to the people that you support. You're going to be following the same steps each and every time you administer medication. So medications fall under brand name and generic names. So a brand name is a medication that's created and made by a specific pharmaceutical company. When that company creates a medication, they're allowed to name it. So some examples are Tylenol, Advil, Prozac. Some other ones that you might be familiar with are Prilosec or NyQuil is a name brand. So those are things that are named by the company. And a generic is the chemical name. So the chemical name would be the generic name of the medication itself, such as acetaminophen, ibuprofen, or fluoxetine. The name brand Prilosec, the generic would be omeprazole. So you're going to see sometimes the names are actually harder to pronounce than the brand name, because the brand name, they're trying to market it and make it so that people can pronounce it or that it's fun to say, versus a generic where it's going to be sometimes a longer name. Oops. I apologize, I lost my spot. Here we go. So the doctor, a lot of times, or the healthcare provider, may order the medication based off of the brand name or the generic name. So when they do submit the prescription for a brand name and the doctor specifically wants that brand name only, they will specifically say brand name only. So that way it's not interchanged. And this is only common with a couple of medications out there. One specifically that I know a lot of times a neurologist may specifically want the name brand only for certain seizure medications, such as Dilantin. Dilantin's generic sometimes can be a little inconsistent with the milligrams. And so if you want somebody to have good seizure control, it's important that their medication that they're receiving is very consistent. So in that instance, it may be really, really important. The other medication that I see physicians only wanting brand name are for ADHD medications. Sometimes those brand name medications have certain coatings on the outside that is important for that person suffering from ADHD to have very consistent medication distribution during the day. So that way it may last a longer period of time. And for some people, they want that person to receive that medication for the entire day. And for some people, it doesn't matter if they have a couple of hours less medication distribution throughout their body. So that is the only two really good examples that I have that a medication may be brand name only. But for most medications, the generic works just the same and is perfectly fine to use. And a lot of times the generic is interchanged for the brand name. So IC is something that you need to know for MAP, and that is the abbreviation for interchange. So, for example, a acetaminophen is interchanged for Tylenol. It's the same thing. It just doesn't, the names don't match exactly. So interchange is important when you're looking at the pharmacy label from the pharmacy. You may see IC and then the other name of the medication. So here's an example of where you may see an interchange. So the healthcare provider ordered Zestril, which is a name brand company, and the pharmacy is putting lisinopril 20 milligrams instead. So that is, lisinopril is the generic, okay? And for this one, omeprazole 20 milligrams is the generic name of Prilosec. So a lot of people know Prilosec, fancy name. It's always going to cost more. When you go, it is something that is sold over the counter. So when you go to the pharmacy, you're going to see that you can get the CVS brand or the Walgreens brand for a lot cheaper than buying the brand name Prilosec. And the other one is ibuprofen. So ibuprofen is the chemical and generic, and Motrin is the name brand of that. Medication schedules. So medications are further broken down into schedules. And this is for all controlled substances only. Controlled substances mean prescription. Okay, so I'm not talking about countable controlled. I'm talking about just a controlled. It's controlled by a pharmacy. It's controlled meaning it's tracked. Okay, so controlled substances are placed into schedules. The schedules are numbered 2 through 6. So you're going to see the Roman numerals 2, 3, 4, 5, and 6. So a substance is placed on a schedule based off of its potential for abuse. So a Schedule 2 medication means that there's a higher possibility of addiction or abuse, and therefore, and this is things like morphine. So for example, morphine would be a Schedule 2 medication, and it's tracked a lot more closer than something that's a Schedule 6. So controlled medications are anything from 2 through 6. A countable controlled would be Schedules 2 through 5. And an over-the-counter is an over-the-counter, meaning you could just walk into any store that sells medications and purchase something without a prescription. In MAP, I want you to remember that any medication requires an order from a healthcare provider. So going into a little bit of a deeper dive, a controlled Schedule 6 medication is something that you need to obtain a healthcare provider's prescription for. So this could be something like an antibiotic. So it's controlled, but it's not a countable controlled medication, meaning that we're not having to track it in a controlled substance book. So things like antibiotics, antidepressants, and antipsychotics, those are just prescription medications. You may have a prescription medication at home that you receive from your doctor. So that it would fall under a Schedule 6 medication. So a requirement to have these medications all require a healthcare provider order in order for us to administer it. And that order would be a signed document from the doctor with all of the required information, the person's name, date of birth, allergies, and the date that it was ordered. It must be labeled and packaged by the pharmacy. So any controlled medication must be labeled and packaged by the pharmacy. It can be in a bottle, and it may be in a tamper-resistant package, such as a blister pack. It always should be stored in a key-locked area, and it must be key-locked. It can't be like number locked or code. And we must always track every controlled medication that comes into the house via a medication ordering and receiving log and a medication sheet where the administration of medication is documented. Medication release documents would apply. So, for example, if somebody's going to day program and receiving medication at day program, we would be giving a release document to the day program to sign for us, signifying that they are receiving medication from us, and it's leaving our I can't speak. It's leaving our custody and going into the day program's custody. It proves that we gave the medication to the day program. And anytime it's disposed of, we have to track it on the disposal record. And that would be located in the MAP book that we have destroyed medication. And that helps us track what medications are coming in and out of the home. So DPH identifies certain controlled medications as high alert medications. That is something that you want to know, whether or not something is high alert. For some examples of high alert medications would be Coumadin or warfarin. Coumadin is the name brand, warfarin is the generic, and that's a blood thinner. And there's a lot of concerns and potential for side effects with those medications, such as bleeding, significant bleeding. So that is a high alert medication. Another high alert medication would be Clozaril. It's an antipsychotic that can reduce somebody's white blood cells so low that they can become sick very quickly. So that also falls under a high alert medication. So those are, you just want to be aware of what a high alert medication is, and that it does require additional training for staff, usually on an annual or a biannual basis. You do want to ask your supervisor if anyone has a healthcare provider order for high alert medication at the home that you're working at, and if so, where is that tracked? DPH sometimes identifies certain Schedule 6 medications as being a high risk for potential abuse. These Schedule 6 medications must be tracked as if they were countable controlled medication. You're going to ask your supervisor if anyone has any healthcare provider orders for high risk Schedule 6 medications at your work location. So going into the second type of controlled medications or type of medications is the Schedule 2 through 5. And these are the ones that you're going to have on count, also called narcotics. Some examples might be prescription pain relievers such as Percocet or Vicodin, or anti-anxiety medications such as Ativan or diazepam. Countable controlled medications are higher risk for being stolen or abused. For these reasons, they must have additional security measures in place. Countable controlled medications require a healthcare provider order in order to obtain the medication from the pharmacy, and the pharmacy must use that information on the prescription to prepare and label the medication. The pharmacy must also add an identifier on the package of the countable controlled medication, and this will alert to you the fact that it is a countable controlled medication. The identifier might be a C that's stamped on the package, and you can see here there is a C that's on the blister pack itself. It can be a prescription number that starts with a C or an N, and a color-coded package. So typically pharmacy would have it, you're going to see here the C or the RX number starting with an N or a C, or you may see a red blister pack. You're going to ask your supervisor how the pharmacy identifies controlled medication at your work location. If the pharmacy has no identifier, the pharmacist must be contacted. The pharmacist will help figure out which medications are countable controlled medications. And just as FYI, this is a federal requirement, but MAP also requires it. A countable controlled medication requirement, it requires a healthcare provider order for administration, just like everything else. Everything is going to require a healthcare provider order for administration. It must be labeled and packaged by the pharmacy in a tamper-resistant package. So this is a little stricter than the other controlled medication that we were talking about. So this is going to reduce the chance that the medication is replaced with a different medication, and it must have an identifier like we just talked about. Again, this medication must be secured, but it must be secured with a double lock. So this is going to have usually a smaller container that these medications are kept in with another lock. So it needs to be locked up inside a locked room or a locked closet. Okay, so double locked. And it must be tracked using a medication ordering and receiving log, a count book, so that when you're administering the medication, you're going to be subtracting each dose individually, and a medication sheet where the medication is going to be tracked and documented that it was administered. And anytime these medications are disposed of, we must be recording the disposal in the DPH disposal record. These medications must be counted each and every single time the storage keys change hands. So at the change of shift, the staff leaving and the staff coming on duty must do a shoulder-to-shoulder count, and this will help protect the medication from being mishandled, misused, or stolen. It helps adhere with laws, regulations, and policies. So this is a really, really specific policy that's important for you to know. It must be followed each and every time that the medication keys are being transferred from one staff to another staff. And lastly, we have over-the-counter medication. And this is also known as non-prescription medication. It can be purchased from a pharmacy without a prescription from the healthcare provider. So some examples might be non-prescription pain relievers such as Tylenol or Advil, or allergy medications such as Benadryl. MAP requires that over-the-counter medications be managed in one of two ways. It may require a healthcare provider order for administration being packaged by the pharmacy in a tamper-resistant package or bottle, or in the manufacturer's container. Managed in one of two ways. Either it's labeled by the pharmacy, where you ask the pharmacy or the healthcare provider to submit a prescription to the pharmacy for the over-the-counter medication, and then the pharmacy will prepare it and label the medication. Or it can be verified by a service provider designee, such as a nurse, verifying that the medication purchased is correct and that the manufacturer's label agrees with what the healthcare provider ordered. So what this is essentially saying, in other words, a staff person could take the healthcare provider order on a healthcare encounter form, go to the pharmacy, buy a bottle of Tylenol as long as it matches the strength, and then brings it back to the home where the nurse can then verify that the medication was purchased correctly, that it's the correct dose and everything, and train the staff on how to administer that medication without a label. So this does require a little bit more training, specific training to the staff who are going to be administering that medication. all medication must be secured in a key locked area. So all medication must be locked up in the med closet or med room. And so over the counters are no different. They still need to be locked up and still have a tracking system. So medication ordering and receiving log, a medication sheet dictating when the medication was administered, and medication release documents. So again, if a person supported is receiving medication at day program and we are bringing medication to the day program, they must sign for what they are receiving, and that form be brought back to the home for tracking purposes that we did bring the medication to the day program, and that would get filed in the map book. So going back to the designee who may verify the medication is correct. It could be a licensed nurse, a pharmacist, or a healthcare provider. And this is important because I've been on an appointment with somebody at a podiatrist, and the podiatrist said, "Oh, I want you to apply bacitracin for the next 2 days to the toe." So in this instance, the healthcare provider was able to provide the bacitracin sample for staff to apply for the next 2 days. And so the healthcare provider was the podiatrist, and the podiatrist did verify that the bacitracin that they were supplying was correct. And then the medication was able to be applied for just the next 2 days. So the site supervisor must check with the MAP consultant to make sure that the product purchase agrees with the healthcare provider order. So this is an example of an over-the-counter medication process. So it says Linda White, the site supervisor, is the service provider designee. Linda checked with the MAP consultant to make sure that the MAP manufacturer's label of the acetaminophen that she purchased agreed with what the healthcare provider ordered. She then documented the date and her initials in the margin of the healthcare provider order. Finally, she documented the name of the person, her initials, and the date on the acetaminophen container. So here you can see on the left-hand side the healthcare provider order. So it's kind of a healthcare provider encounter form. So here the healthcare provider ordered acetaminophen 325 milligrams as needed PRN every 6 hours by mouth if self-reports headache. So Linda White or somebody else went out and purchased a bottle of acetaminophen, and Linda White verified as the designee that this was the correct medication. She wrote the person's name, Scott Green, as the person supported. She wrote her initials and the date that she verified. And then on the column in the margin here, she also wrote her name, her initials, I should say, and the date. And that verifies that she verified a container of acetaminophen. Some things that you want to know are sunscreen, insect repellent, and non-prescription personal hygiene cleansing products do not require a healthcare provider order. However, the service provider with the person's healthcare provider might decide if one of these products do require a healthcare provider order for tracking and follow-up. So an example of this might be somebody who goes to the dentist. They like to use Listerine every day, but the person goes to the dentist and the dentist says, "Ooh, they're developing gingivitis and I want them to use Listerine for their gingivitis." Well, now that Listerine has not become a hygiene product anymore. That Listerine has become a treatment for their gingivitis. And we need to track that Listerine is being used each and every day for their gingivitis. So that then becomes a healthcare provider order, and that Listerine becomes a medication, and we need to have that tracked as a medication for their treatment of gingivitis. Now, in addition to the 3 categories of medications, there are dietary supplements. So dietary supplements are usually contain dietary ingredients, for example, vitamins, minerals, herbs, or other supplements, substances. Unlike medication, dietary supplements are not pre-approved by the government for safety or effectiveness. They may be purchased from the pharmacy without a prescription from the healthcare provider. So some examples of these may be like multivitamins, fish oil, shark cartilage. So MAP does require that all dietary supplements be managed in one of 2 ways. So we do need a healthcare provider for the administration. They must be packaged either by the pharmacy in a tamper-resistant package or bottle, or in the manufacturer's container. They must be managed in one of 2 ways. They must be labeled by the pharmacy, so asking the healthcare provider to submit a prescription, which is definitely more ideal, or we can verify it by a service provider designee. Again, it could be a MAP site supervisor or a nurse could verify that the medication, this wouldn't be technically a medication, it would be a dietary supplement, that the dietary supplement is correct and the correct dosing for the person supported. So again, you must be trained before administering the dietary supplement if you're not having it verified by the pharmacy. So anything not prepared by the pharmacy must be verified by a site supervisor or nurse, and the staff must receive a special training. So again, we definitely always prefer everything go to the pharmacy as a prescription. But there might be some times going through the pharmacy might be more of a cost to the person supported. For example, if the pharmacy is going to charge $75 a month for a dietary supplement, but we could purchase it at Walmart for $12 a month, that might be the best way to go for that person supported. So again, the verification procedure is going to be the same as an over-the-counter. Again, all medications, dietary supplements, always must be secured in a key-locked area. So whether it be a closet or a room, it must be in a key-locked area, and always tracked using the medication ordering and receiving log, just like everything else. There should be a med sheet, just like everything else, and a medication release document. Again, if we're bringing dietary supplements to a day program, then we need to have it tracked how many we're bringing and dropping off at day program. They're going to sign that release document, and we're going to file it back at the home, proving that we've brought the medication to the day program. You're always going to want to ask your supervisor if there's any over-the-counter medications or dietary supplements without a pharmacy label. If so, you will be scheduled for a training typically it's with the nurse. You cannot administer any over-the-counter medications or dietary supplements that don't have a pharmacy label until you've received this training. And the training is specific to the med. So if somebody takes 3 medications that are not labeled by the pharmacy, then you will need 3 trainings for those 3 medications or dietary supplements. Nutritional supplements such as Ensure, gastric tube feedings, Carnation Instant Breakfast, for example, they are not medications and don't fall under MAP. So this is a benefit as well to the people we support. So that way, if somebody's not MAP certified, they would be able to give these nutritional supplements without being MAP trained. But they usually are tracked on a various form, such as a treatment sheet. So here you can tell if something's an over-the-counter medication, a dietary supplement, or a nutritional supplement. And this is a over-the-counter medication. I'm sorry, it's such poor quality, I can hardly read it myself. But this is you're going to see drug facts. I can barely make that out, but it does say drug facts. So a drug fact means that it's a drug, it's a medication, and not a nutritional supplement. And any dietary supplements will have a supplement facts listed on the label. And if it's a food, it's going to have a nutrition facts label. So you're going to see that this would be technically a food and really wouldn't fall under MAP jurisdiction. So true or false? Additional training is required to administer over-the-counter medication and dietary supplements without a pharmacy label. Is that true or false? That is true. You do need additional training to administer over-the-counter medication and dietary supplements. Number 2, true or false? Sunscreen, insect repellent, and non-prescription personal hygiene products do not require healthcare provider order. That is true. You do not need a healthcare provider order to apply sunscreen, insect repellent, and non-prescription personal hygiene products. True or false? Nutritional supplements fall under MAP. That is false. Nutritional supplements such as Ensure or Boost supplements do not fall under MAP. Number 4, true or false? The over-the-counter medications and dietary supplements without a pharmacy label training is person and product specific. That is true. So you do need specific training to administer anything that does not have a pharmacy label. You will need to have a specific training for those medications and for that specific person. So just to even highlight this a little bit more, if 3 different people in a home buy over-the-counter acetaminophen for headache or fever, and they all want to purchase it at Walmart instead of getting it through the pharmacy, then the staff would need to be trained on acetaminophen for all 3 people separately. You could do it all in one day, but it just needs to be signed off on different forms. Okay. Multiple different medications may be packaged by the pharmacy in a single tamper-resistant packaging. This is known as multi-dose medication packaging. So you need to ask your supervisor if multi-dose medication packaging is used at your work location. If so, ask when you'll receive the pharmacy packaged multi-dose medication packaging training. So currently we do not have anybody in a MAP home that uses this type of medication administration. However, it is something that some places are